Welcome to Your Dialysis Nurse. I'm Nurse Nicole, and today we're going to be talking about the role of a hemodialysis nurse. Now, some of the things that a hemodialysis nurse does is throughout the day, she's going to dialyze to 12 patients per shift. Give or take, some clinics have 10 patients per shift, some may have 24 per shift. Usually, there's 3 PCTs if there is a 12 patient clinic or CCHTs. And the shift will last anywhere from 12 to 16 hours. The nurse will do pre and post assessments and administer meds, including antibiotics and vaccinations, monitor labs biweekly, and also complete care plans on each patient, access notes, and RN monthly progress notes. So that's just the key items that a hemodialysis nurse will normally do throughout a shift or as her role. How many patients are dialyzed per shift? In most outpatient clinics, there will be a ratio of at least 12 patients to one nurse. Now, this may vary depending on how many stations are in the clinic and whether or not the clinic is short staffed with RNs. In total, we dialyze about 36 patients in my clinic a day on the hemodialysis side, and each patient treatment can run anywhere from 2 hours to 5 hours. Vitals are taken every 30 minutes unless you set it to take it more often. That's usually for the more unstable patients. You are in charge of the patient remaining stable the whole treatment. In outpatient dialysis, you will usually have at least one tech per 4 patients to work with, depending on staffing. In 2022, I worked the whole year down one technician. Therefore, I had to work as the tech and the nurse on the floor. Those days are usually the longest and can turn a 15-hour shift into a 17-hour shift. And there's nothing you can do about it. It's just the world of dialysis. That's why you have to love what you do in this field. Pre-assessments of the patient and their access are completed before each treatment starts. You also will complete post-treatment assessments for each patient. When you complete these pre-assessments, this is how you will be able to identify how much fluid you will need to remove from the patient and whether or not the patient is stable enough to start treatment. There is a special calculation to determine how much fluid you can remove in that one treatment, which I will touch on more in another video. Depending on the company and your clinic policies, you will be required to give patients heparin to dwell anywhere from 3 to 5 minutes prior to the start of treatment to prevent clotting of the blood lines, as well as post-treatment if the patients have a catheter. Epogen and iron is usually given for anemia, clonidine for hypertension, calcitrol for hypocalcemia, and IDPN for low albumin. Antibiotics are also prescribed for infections and can be given during treatment or towards the end of treatment. We are required to monitor labs bi-weekly and assist with epogen and iron changes. We also need to report any outstanding lab results ASAP, and patients cannot dialyze with a hemoglobin lower than 7. There are monthly tasks that the RN must complete: care plans for all new patients, patients that have been there for 90 days, unstable patients, and annually. Access notes on each patient, nursing progress notes in which you address the labs as well, hepatitis tracking, infection tracking, as well as tracking missed treatments for each patient. I know all of this sounds like a lot, but don't worry. You will work alongside the MD, CM, social worker, and dietitian, and CC if your clinic has one. Hope you learned a little bit more about the role of a dialysis nurse. Thanks for watching Your Dialysis Nurse, Nicole.